My name is Marissa Todd, and this research proposal is discussing childhood trauma and declarative memory performance. The purpose of this research proposal is that traumatic events that occur during childhood leading to post-traumatic stress disorder have been shown to be linked with the development of hypertension, which can impair one's declarative memory performance later in life. Going into the context of this presentation, there's two terms we need to define: declarative memory, which is associated with the memory of facts and actual experiences that the individual can verbalize, and hypertension, which refers to high blood pressure and can be the result of both lifestyle and environmental factors. Previous research suggests that traumatic events that occur during childhood, such as verbal and physical abuse, have been shown to correlate with an individual's risk of developing high blood pressure, which can result in the condition of hypertension, which is prolonged high blood pressure. In addition to this, autonomic dysregulation and the hyperarousability hypothesis are linked to hypertension as well. Autonomic dysregulation just means the body is unable to automatically regulate itself as far as temperature, emotions, etc. The hyperarousability hypothesis refers to an individual's enhancement of risk-taking behaviors such as excessive drinking or emotional incapacities. In addition to that, hypertension is associated with reduced functional connectivity of the hippocampus, which is where declarative memory is exhibited through. So my proposed study has three variables, one being the independent variable and then two dependent variables. The independent variable would be the participant's formal diagnostic status of either having PTSD associated with childhood trauma or not having PTSD at all. The dependent variables will be hypertension, which is high blood pressure, or the participant's cognitive skills associated with declarative memory performance. Going into methodology, we're going to talk about the participants first. We're going to have 100 total participants in order to have the highest statistical power, 50 males and 50 females. 50 of these participants will have a formal diagnosis of PTSD associated with childhood trauma. The age range of this study is going to be between 25 and 60 years old with a mean age of 37. We're starting at 25 due to the memory recall test, the declarative memory test we're going to be talking about. It says that it's only really valid after the ages of 16. So 25 to 60, your memory performance kind of declines a little bit at the end of your adulthood life. So we don't want to go too far into ways in which people can develop hypertension and memory performance based on age alone. For this proposed research, we're going to be using two materials, one being the Ray Auditory Verbal Learning Test, which is a list learning task measuring recall, recognition, and the learning processes of verbiage. The second being basically what is simply put a blood pressure monitor cuff. There's multiple blood pressure monitor cuffs you can use. This one's going to be the latest edition of the Paramed Aneroid blood pressure monitor cuff, and that's what's pictured here. You can use ones that are self-monitored, but we're going to be using one that is going to be administered by a health professional. The procedure of this proposal will be quite easy, as initially participants will have their blood pressure taken to record baseline data. This is to determine whether any of the participants have low blood pressure initially or have typically a higher blood pressure, in order to determine whether or not anxieties from testing causes you to have high blood pressure, etc. Following, a clinical scales rater will administer the RAVL test, and a certified medical professional will record the blood pressure levels again. Scores from RAVL and then levels recorded from the blood monitor will be cross-examined to determine any correlation. Obviously, we're not determining causation, more so just if there's any correlation between high blood pressure scores, low declarative memory scores, and vice versa, as that is our hypothesis. It is hypothesized that high blood pressure levels will be matched with low levels on the Ray auditory learning test. This is a list of my references, and that concludes my research proposal. Thank you so much for listening.